Hi, everyone, and thank you so much for joining us for Their Story Isn't Over, Support and Healing for Older Survivors. Before we get going, I want to give a nod to the Office on Violence Against Women for sponsoring this webinar today. And I want to remind you that the opinions, findings, conclusions, comments, recommendations that you hear today during this presentation are those of the author and don't necessarily reflect the views of the Office on Violence Against Women, the U.S. Department of Justice, or the National Council of Juvenile and Family Court Judges. I also want to add that the pictures that you see in this presentation are models. The only exception is we have a couple of videos, and those videos are actual survivors. And with that, I am going to turn it back over to Neelam Patel.
Thank you so much, Marty. Hi, everyone, and welcome to today's webinar. Together as partnership with the National Council of Juvenile and Family Court Judges and the National Clearinghouse on Abuse in Later Life, we are so happy to be able to present this webinar in commemoration of World Elder Abuse Awareness Day, which was on Sunday, and you'll hear more about it later in the presentation. But also to really discuss and go a little deeper into abuse in later life. As most of you probably know, OVW does have a grant program on abuse in later life, but abuse in later life covers all of our OVW grant programs. It is instrumental that all of our grantees understand how to provide effective and efficient services to elder adults across all the different victimization spectrums. So we're so happy to have you join us and learn a little more about abuse in later life and to see how you're going to be able to incorporate this work into your services that you provide. So without any further delay, I'm going to pass this over to Marty and Victoria. Thank you.
Okay. I'm Marty Washington. I'm the Abuse in Later Life Program Coordinator with the National Clearinghouse on Abuse in Later Life. And I just got to add that I have a social work background before I joined National Clearinghouse on Abuse in Later Life and was a social worker in a long-term care facility. So that's the perspective I bring to this presentation. Victoria?
Hi, everyone. So excited to be here. So I'm Victoria Ferguson Young. I'm the Victim Services Coordinator for the National Clearinghouse on Abuse in Later Life. And so I have the privilege of working with primarily our grantees on all things surrounding victim services, direct services to older adults, and also to provide trainings and information for the field. And so to do webinars and things like this for advocates and service professionals throughout the field. But a pleasure to be here with you today.
So a little bit about the National Clearinghouse on Abuse in Later Life, or NCALL, as you'll hear us say. This is an initiative out of the Wisconsin Domestic Violence Coalition, which is called End Domestic Abuse Wisconsin. And you see our mission statement on this slide. We are the OVW technical assistance provider for the Abuse in Later Life grant that Neelam referred to. We also have an OVW sponsored National Resource Center. The work we do is in recognition of the fact that abuse occurs across the lifespan, and aging doesn't protect anybody from experiencing abuse. Yet older adults often aren't considered when we're doing program and policy development. So our work is really to raise visibility of the importance of engaging with older adults in our work. In our time together today, we're going to learn about World Elder Abuse Awareness Day. We're going to talk about what we mean when we say abuse in later life and the dynamics of domestic violence, sexual assault, and stalking when you're working with older adults. Talk about victim-centered approaches to working with these survivors, learn more about the grant program, the Abuse in Later Life grant program. And also we will share with you some resources that NCALL has available to help you in your work. First, World Elder Abuse Awareness Day. This day was first launched in 2006 by the International Network for the Prevention of Elder Abuse and the World Health Organization at the United Nations. And it was to provide an opportunity for communities to be able to promote a better understanding of abuse and neglect of older persons. It is celebrated on June 15th every year. If you click on the QR code, and I believe you will get a copy of the slides when this is over, if you click on the QR code, it will bring you to the NCALL website where we have some information on the World Elder Abuse Awareness Day. And also this particular page examines ageism in the context of elder abuse. We also have a blog called An Opportunity to Raise Awareness and Build Community that focuses specifically on World Elder Abuse Awareness Day. So what can you do about this raising awareness? One of the most important things to start with is to really examine what your attitudes are towards aging and how that might affect how you do your work. Understanding that these cases involving older survivors are complicated, and it's really important to believe them when they come to you and to trust that they know what's best for them. Stop the erasure of older adults. Be looking at what's pictured on your materials, how you incorporate older survivors and their voices in your work. And examine, what you can learn from them. And also developing services and programs that are intentionally inclusive of older adults and specific to that population. You don't have to wait for World Elder Abuse Awareness Day. You can raise this awareness throughout the year. And that might involve having some awareness on your social and print media or your awareness campaigns. When you are reviewing programs and policies, involve older adults in the discussion. This idea of nothing about us without us. Incorporate feedback from older survivors when you are looking at your resources. They can tell you whether these are going to resonate with older adults. And also lift up older survivors' stories by inviting them to share their lived experiences. And this might mean sharing that information with law enforcement or courts or local and state representatives or any key stakeholders that work with older adults. Why is this important? Because America's getting older. 11,400 of us turn 65 every single day, and more than half of those individuals are female. Just to make sure we start off with the same definition, NCALL uses the Elder Justice Roadmap definition. Elder abuse is the physical, sexual, or psychological abuse, and neglect, abandonment, and financial exploitation of an older person in any setting, either in a relationship where there's an expectation of trust or when the older person is targeted based on their age or disability. Abuse in later life is a subset of elder abuse, and it focuses very specifically on that connection point between domestic violence, sexual violence, and elder abuse. And what we're talking about is abuse that's perpetrated on an adult that is age 50 and older, that is perpetrated by somebody who is in an ongoing trust-based relationship with them. So the only exception to this would be stalking and sexual assault, because that, even by a stranger, is still considered abuse in later life. The reason this is so important to look at this nexus point is because, for example, sometimes a survivor, an older survivor, will go to a domestic violence service provider, and that person is trained to respond to their needs, to try to help them with whatever they want. But they may not consider, this person is older, maybe I should reach out to an aging services professional for those specific dynamics related to older adults. By the same token, maybe an older survivor touches base with a aging services professional, and that person doesn't consider, wow, maybe I should bring in a domestic violence advocate who's specifically trained for that kind of work. So it's really important to look at this, look at this connection between domestic violence and sexual assault and elder abuse. I also want to add, you heard me say age 50 and older, and the reason for this age, the rationale for this would be when somebody's in their 50s, they might not be raising children anymore unless they're raising grandchildren, but they might not be raising children anymore. So they're not going to be on the radar of the school system or TANF or anything like that. They're too young for Medicare. They're not going to be on any of those radars. So this tends to be a really silent decade, and they still may be vulnerable. And so that's why abuse in later life includes individuals age 50 and older. I'm going to skip that. So, so many times when we think of abuse in later life, we think of facilities. And I got to say, if I had $1 for every time somebody asked me what I do for a living, and I say I work on abuse in later life, and they automatically think I'm talking about people that live in a facility. It's just everybody goes there. But the fact of the matter is at least 1 in 10 individuals that live in the community have experienced some form of abuse. This statistic comes from a telephone poll that was done. And what they did was they called individuals on landlines and asked them some questions. The thing about this is this survey only counted those that had a landline, and it only counted those that were able to answer the phone and were able to answer the questions. So you can see there's a huge swath of people that were not included in this survey. So if you think 1 in 10 might sound like a huge issue, just keep in mind it's very likely an underestimate of how big this situation is. Another study found that for every 1 case of elder abuse that comes to the attention of a service provider, another 24 never come to light. So you can see why it's so important that we learn about elder abuse and abuse in later life, so we're able to respond to these cases that may not come in the traditional way onto our radar. They're harmed in a few different ways, but specific to older adults, sometimes the harm is motivated by greed. An example might be, hey, I was going to inherit this house anyway. I was going to inherit your money anyway. You don't ever do anything with your money, so I might as well take it from you. Very often, greed is a motivating factor. Another motivating factor would be predatory behavior, where the abuser sees the survivor as someone who is vulnerable and easy to take advantage of. They may have lots of medications that are super easy to divert to their own use. They may have feel that they can abuse the person because they are vulnerable and nobody's going to find out or believe them. This is all about power and control over that person. Other ways they may harm someone is sometimes an abuser has a mental health condition that may be violent in nature. They may suffer some kind of a medical condition that may change their behavior, developing dementia, that kind of thing, that may cause them to behave in a violent way towards their loved one. Also, you have well-intentioned but ill-equipped caregivers. Please understand, I am not saying that caregiver stress is a justification for abuse. It never is a justification for abuse. I'm just saying that some caregivers are not equipped to deal with what comes with taking care of an older adult. Study after study have shown that a large proportion of elder abuse cases involve female victims with their spouses as the perpetrator. So you can see that intimate partner violence is a huge part of abuse in later life. It also occurs in long-term relationships or new relationships. If long-term, maybe the person never really understood that what was happening to them was abuse. They may have learned coping skills along the way. And so they've just stayed in this relationship. Maybe tactics have changed from physical to psychological, emotional abuse. So they just don't recognize what's still happening as abusive. It can occur in any setting, as I mentioned before. And it can also occur as a late onset situation. Let's say one of the partners develops dementia and it changes their personality, et cetera. So there's many ways that intimate partner violence can go into later life. For those of you in the field of advocacy field, you've seen this power and control wheel 100 times, I'm sure. This wheel was developed by the Domestic Abuse Intervention Project out of Duluth, Minnesota. But what NCALL did was they had a listening session and they with older adults, and they changed it a bit to incorporate abuse in later life into it. So you see emotional and psychological abuse on the spokes, and they were intertwined with all the tactics you see around the circle. Those are all tactics that that you might see in abuse in later life. And I'm just going to, I want to go through them because we're going to be showing a video next. And I really want you to be thinking about these tactics as you watch the video. Threatening somebody, targeting their vulnerabilities and neglecting them, denying access to spiritual traditions, ridicule, using family members against them, isolating them, using privilege, exploiting them financially. All of this really is all about power and control over that individual. So keep that in mind as we're going to watch this video. So Tammy is the first person you're going to hear from. Tammy is 58 years old and has suffered physical and sexual violence. And she got help through an area agency on aging where they actually had a person that understood domestic violence dynamics. So that was really great for Tammy. Mary Lou left a long abusive marriage when she turned 65. She finally left the marriage. And she got help from a domestic violence shelter that happened to have some expertise in working with older adults. So let's listen to these two describe their situation.
I was in a relationship which I had been in for a few years actually, but it really wasn't us as a relationship living together until like maybe the last year. As time went on, he started with wanting more than what I was willing to do. He started making, suggestions, and because I loved him, or I thought that would be the right thing to do, at least try. But the suggestions was not something that I was comfortable with, and I told him that. There was times when he would basically try and force himself on me. It got to a point where he was really strong arming me, like he'd take my arm and twist it behind my back and try and force me to do what I didn't want to do.
They were never threats, it was just immediate actions. And the fact, the unsuspecting. Like a Thanksgiving dinner, his family was coming and I did something and I had a black eye. And I had to kind of proceed with having 26 people for Thanksgiving dinner, or taking my son to get a a jacket. And when we asked him if he could do that, I got a black eye. So it was spontaneous. There was never any like warning that it was coming, the physical abuse. The public place and the private place was happening all the time in our marriage with the kids. We would have people coming in the driveway and we'd had a fight and I'd been crying, and he would then say to me, "Mary Lou, do you love me?" And I would say, "Yes." And they'd be getting out of the car. So these are your friends, you know, I don't have to be nice to them. And then just like that, they'd walk in the door, you'd be all smiles, and no one would have suspected. I was an excellent first grade teacher and I loved it. And I would do innovative things, and I'd come home and tell him. And he said, "Wait till they find out what a fake and a fraud you are." The pain was so bad that I wanted to kill myself, to end my life and end the pain. And praise God, I knew I had more living to do. And I didn't. But again, he took that situation and me, and my last hope is saying, maybe he'll understand how bad I am feeling, and told him I had attempted suicide. And he said, he went and got a gun. And he said, "I'll show you how to put a gun to your head and be successful committing suicide." And I still hear the cylinders from that situation.
So, as I mentioned in the beginning, these were actual survivors that allowed NCALL and Terra Nova Films to interview them on camera. So, I am so appreciative of their resilience. What tactics did you see being used against them? Can I have you throw your thoughts into the chat? And just to make it easier for you, we have the power and control wheel right here. Absolutely. The ridicule too. Mary Lou was definitely ridiculed, all of them, I'm sure. Using privilege also, sexual abuse. Yes. Thank you very much for that. Being the one to make the rules and ruling the home, passive aggressive, definitely. So basically, to just sum up so far, domestic violence and abuse in later life. Domestic violence in later life can occur in new or long-term relationships. Many elder abuse cases involve domestic violence, and these power and control tactics are used against older victims, and the barriers they face are often age-specific. So we're going to switch gears a bit, and I'm going to turn it over to Victoria.
Hello, everyone. So I'm going to talk to you a bit more about some additional difficult types of abuse that older adults face. And so we'll start with elder sexual abuse. And this type of abuse often occurs as a result of a pattern. It's often an embedded pattern that an older adult is facing, and it can happen in domestic settings and also in institutional settings. But it is something that happens much more frequently than many of us may realize. And to tell you a bit more, to talk a bit more about what do we mean by sexual abuse, like what kind of falls under this umbrella. So first, it is hands-on behaviors, such as even the most egregious or physically harmful, like rape or molestation. But it's also hands-off behaviors like voyeurism and exhibitionism, which can involve having someone watch someone engage in a sexual act or watch pornography or something of that nature against their will or without their permission. Sexual threats and even unwanted comments and harassment fall under sexual abuse, as well as harmful genital practices. We have learned from our work that there are caregivers who, if there's an older adult who requires, that they have to have assistance with bathing or using the bathroom, that someone can inappropriately touch their genitals or just use too many very aggressive hands-on behaviors there, or even like creams in inappropriate ways. So all of those types of actions fall under the abuse in later life, sexual abuse in later life. Additionally, because this is quite underreported, we know that, there are serious underestimates even from the data that we have. So there's much more research that needs to take place. And we know that many older adults who are victims of sexual assault and sexual abuse are not reporting it. They're not coming forward. They're not disclosing. And we'll talk about just a second some of those reasons. Because there are many misconceptions about sexual assault with older adults or sexual abuse. Oftentimes, people just don't believe that it really happens. People may think that older adults, just know they wouldn't experience that. Older adults who are in their 80s or 90s wouldn't be victims of sexual assault. Unfortunately, that's not the case. And so it's important also to remember, again, as Marty showed that power and control wheel, that abuse and sexual assault is all rooted in power and control. It's not about sex. It's not about pleasure. It's about power and control. And so now with even talking more about this issue with older adults, there's, much more, we're starting to turn the tide there, but there's much more work that can be done to make sure that those when someone hears or when it's disclosed to them, especially as a service professional, that they are believing that sexual assault and abuse is taking place against older adult victims. Let's talk a bit more about the perpetrators of sexual assault. We have found from our research that, in communities, older victims are those who do report, are reporting that, they're being violated by people they know, in particular their spouses or their partners. So that is where we're seeing most perpetrators do fall in that category. For those who live in facilities, so those who may be in hospitals or nursing homes or rehab centers or memory care facilities, things of that nature, that employees responsible for care, 43% of them are often perpetrators, and even other residents who live in those facilities can be offenders as well. Additionally, perpetrators of sexual abuse, again, are motivated by, by domination, by power, by control, want to humiliate. This act is not about pleasure. It's not about sex. It's very much about and centered in power and control. Also, perpetrators are very intentional and very deliberate in who they target. Oftentimes, those older adults who have increased vulnerabilities, so those who may be living with a disability, those who may need additional assistance, even those who have maybe memory loss or dementia or living with Alzheimer's may be especially targeted because they may not be believed that, if they disclose what has happened to them. So perpetrators, and also it's important to note that, in this regard, when we talk about sexual abuse in later life, we are also talking about strangers who commit sexual assault and sexual abuse against older adults. And the severity of injuries with older adults is much worse typically when there is an instance or an incident of sexual assault. So due to just age-related physiological changes in one's body, we see that older adults sustain greater injuries, have a harder time recovering, just may have more bruising, just more injuries to their bodies due to a sexual assault that has taken place. So again, to talk a little bit more about strangers, that this does fall under, when we talk about sexual abuse in later life, we are also including strangers who commit this. And so in just a moment, we'll watch a video about a woman who was a victim of sexual assault by a stranger in her home. This is less common, but it does happen. Again, as service providers, it's important to just recognize and be aware that, that this type of abuse, this type of sexual assault is something that older adults face, and something that as you talk with or even engage with older adults in your service provision, if you come to meet with an older adult who seeks you for services, to in your conversations to ask more about, if this is something that someone has experienced, if they, have had someone who's touched them inappropriately, because it is something that older adults are living with and are fearful of reporting. So next, we'll go into and we will watch this brief video about Linda, who is a victim of sexual assault by a stranger. I do just want to disclose that this is a difficult video, and so she does share the more details about what happened to her. So please take care of yourself as necessary. And then on the other side of the video, I just have a few questions I'd love to get your feedback on in the chat.
Sunday morning, about 4 o'clock in the morning, I heard this loud crash. And I thought my cat, Tuffy Lovekins, had knocked a big lamp over in my living room. And when you're sound asleep, and you don't know who you are, what you are, or where you are, and I jumped out of bed and I hit my touch lamp and said, "Tuffy, what have you done?" This Mark was right in my doorway, in my bedroom doorway. He had a hoodie on, pulled down over his face, and he had a gun pointed at me. And I let one blood-curdling scream. I didn't even know I had that kind of a scream inside me. And he said, "You scream one more time, I'll kill you right here." And he proceeded to make me kneel down in front of my bed. And he took a pillowcase off my pillow and put it over my head. And then he lifted me up onto my bed and he took my pajama bottoms off and he started fondling me and doing oral sex and proceeded to rape me. I didn't even realize all the bruising and the biting that he had done to me until I got to the hospital. But anyway, through the whole thing, I have a very strong faith. And I prayed to God and Jesus not to let me die this way. I didn't want my son or my other family members or friends to have to live with the way that I might have died. I'm not afraid to die, but I wasn't going to go that way. When he was finished with me, he put me back on the bed. Everything was done from behind, and he had me out on my bed like this. And he covered me up with all my bedding, and he goes, "Do you know your family?" And I said, "What?" He said, "I know your family." He said, "You say anything about what happened to you here?" He says, "I'll take them out, I'll come back and I'll kill you." And when I realized he closed the door, I just said the Lord's Prayer, reached for my phone and dialed 911.
A number of officers were able to respond. We had a lot of things going for us. There was snow on the ground. We were able to follow footprints. The person was intoxicated, so they weren't thinking clearly. They made a lot of mistakes, including dropping personal items. So within a very short time, we zeroed in on the person that was responsible.
I went in and introduced myself and told her what I did and what our services were, and kind of gave her a little synopsis of what was going to happen, how long it could take, just all the kind of pros and cons of having the exam. And she wanted me to stay in there, so I did.
Oh, they were so good, and they put me at ease. If I could be at ease, I finally stopped shaking. I couldn't stop my body from trembling, but after a while, but my sense of humor kicked in. And they had me in more positions than I can count. Modesty left the building. And in the meantime, an RN was helping Sherry. Her name was Sally. And she was doing all the swabbing and everything. And Sherry was standing there with the camera taking pictures. And I don't know where this came from, but I said, "Sherry," and so everything stopped, and she said, "Yes, Linda." And I said, "I don't want to see these pictures on Facebook in the morning." I don't know why I did that, but I think God gives you a way of coping, and I think humor was my way of coping.
Okay. just want you all to take a breath, take a moment to know there's a lot that's shared in that video, but I'd love for you all to use the chat. I see some of you already typing some things in, but just would love to get your reactions to hearing Linda's experience. I see lots of wow, she's amazing. She's so resilient. She is. There are just no words for what she went through. She's tough. Absolutely. Absolutely. I mean, it is as service providers and as those who, work in this field and work with older adults, it is truly amazing to always see their resilience and what they're able to tackle and to navigate. So lots of themes of resilience, toughness, strong, her strength. She was able to cope beyond understanding. Definitely. I see someone says a lot of survivors may feel guilty. She also talked about her faith. Absolutely. So I think we're starting to move into the next question there. What factors allowed Linda to begin to heal from her assault? Her faith kept her strong. Absolutely. Definitely her faith. All the responders and all of the caregivers who helped her. She had a positive mindset. Definitely. She was believed. Yes. And even, yes, the fact she was able to share her assault could even be a point of strength for her. So her faith, absolutely. The sensitivity of caregiver, she had a great support system. So let's move to our final question then. You all are doing great. Appreciate the interaction here and all that you're sharing. How could you support a survivor like Linda in your role? Yes, positive mindset and support system, definitely. Anything in particular that you'd like to share that you would do to support a survivor like Linda? So someone says empathy and allowing her to have her experience in her way. Yes, play up her strengths, definitely. Believe her every word. Refer her to one safe place, okay? So a location for services. Not assume and ask for what she wants and needs, definitely. Compassion and listening, making space for her to feel her. You guys are on it. Point out to her that her strength is amazing. You're absolutely right. You all are definitely on it. Connect her to our hospital for a forensic exam. How to help her feel safe at home afterwards. Listen to her. Validate her feelings. Allow her the space. Connection to counseling, safety planning. Yep, all those things. So you all are definitely on it. So you can keep them coming in the chat. I'll move forward, but we've answered these. So again, we see that survivors are incredibly resilient and that there are many factors that they may have, and so important to remind them of their strength, what's helped them to overcome things in the past that could be helpful to them now, listen to their needs. And you all have shared so many things, also information about grief and loss, so many ways you can support her. But what I hear as a theme too is that it's really allowing her to share what she needs and to listen to her needs and to validate her experiences. So great job, everyone. All right, so a few key takeaways here on sexual assault. Just want you all to remember that this does occur across the lifespan. We may not often hear stories like Linda's or even of other older adults who are victims of sexual assault, but it does happen and it is happening, unfortunately. Just remember that it's highly underreported and under-researched and under-discussed. So the more we talk about it, especially as service providers, the more that, we allow other people to come forward and we signal to them that you can be a source of support or help when it is shared that, that's something that you do, or that this is an issue that older adults are facing. Also important to note that most sexual abuse occurs by individuals known to the victim, although of course it can occur by strangers as well. So moving into stalking, this is another type of abuse that falls under the umbrella of abuse in later life. And it also can occur from someone who a person knows, a victim knows, or someone that they don't know. But stalking is another type of abuse that we often may think older adults aren't facing, especially in large numbers. But almost 30% of all stalking victims are age 50 or over. And so more than 600,000 people over the age of 50 were victims of stalking within a 12-month period back in 2021. So this is a very prevalent issue that older adults are facing. And so what do we mean by stalking? So here's the behavioral definition. So it's a pattern directed at a specific person that would cause them, a reasonable person to feel fear. So really being intentional about trying to scare them in some way, surveil them in some way that is against their permission, something that they don't want to have happen. But this is, what we're classifying as the behavioral definition. What are some of the tactics of stalking? So what happens? So it can be unwanted contact through phone calls, texts, even through social media. It can be sending unwanted gifts over and over. Maybe someone ended a relationship and that person is sending gifts that someone no longer wants to receive. Showing up unannounced, approaching an individual when they're with their family or friends, showing up at their doctor's appointments or, at their jobs. Monitoring what they're doing or surveilling what they're doing, damaging their property, threatening to do things. All of these fall under the tactics of stalking. And here we have some headlines to just show real life how older adults have been, some real cases of older adults who have been victims of stalking. So one, an older adult man in St. Paul got a ride from gave someone a ride and then that person stalked him. And then someone stole almost, $4,000 from an older adult victim with an almost daily loan request. Unfortunately, we see exploitation and things like that happening. And so just, these unwanted phone calls is constantly contacting someone against, their will or without their permission. There's also a case in which a man pled guilty to stalking his wife and then later killing her. And we see there's another headline there as well from a woman who was withheld from her meds and stalked and abused. So what are some of the specific challenges for older adults who are victims of stalking that may be a bit different from younger adults? One thing is that there's definitely very tech literacy or, just tech savviness amongst older adults, but not for all. Some older adults enjoy their phones and social media and are tech savvy, and others, they're maybe just not comfortable with it. And so, there can be cases in which caregivers or even family members may access someone's bank account because, they don't realize that they may not use online banking, but they may set it up for them and then access it, or may monitor their emails, and someone may not know it. So that's a way that, that stalking can also take place. We may minimize the threat because younger people may think, or service providers may think, you're not really being stalked, you're just making this up. I don't think no one's going to take the time to do that. And so this minimizing of someone's experience or even what they disclose. We may think that someone has memory loss or dementia or Alzheimer's and that they're confused. They don't really know what they're talking about. And so their claims can be dismissed. If someone uses medications as well, if there's something that they rely on, maybe it makes them have to rely on someone else, and so they can be more vulnerable to stalking, to surveillance and monitoring, and other also people just may not believe again that it's really happening. Like you can't really comprehend that an older adult person is being stalked. So if anybody has any other specific challenges that you've seen, feel free to add those in the chat about some other challenges that older adults may face in particular surrounding stalking. But these are some ones we want to bring to your attention. Few other stats here. 77% of older adults were told, that they're overreacting, and 66.7% for older adults were not taken seriously by police either. So older adults aren't getting the reaction of urgency to help them when they are disclosing normally. So what are some ways that you can support? We've talked about this even with the last case, believing someone, reminding them that it's not their fault, being aware that, an older adult may not recognize or think that they're really being stalked. They may use different language. They may just say someone is bothering them or always showing up. So they may not use the term stalking. They may not see themselves as a victim, but something that is annoying them or bothering them or harassing them. As well, it's also important to conduct stalking risk assessments and safety plans. I'm going to give you some resources on how you can do that in just a moment. Many older adults use technology, but some really have to aren't as savvy with technology, or maybe aren't aware of maybe any type of a tracking device or thing that could be on their phone. And then also it's important to advise victims to document and log things that are happening to track incidents that have occurred. So for resources, there is a link I wanted to provide you to Sparks, some of their resource center. And so I'm going to add that into the chat real quick for you. So if you'd like to just get some more resources specifically on stalking, so SPARK is the Stalking Prevention and Awareness Resource Center. They have lots of information that can be really helpful for you as service providers, and and also information specifically that can be shared with those who are victims of stalking. So wanted to point you in that direction. And some key takeaways here. Stalking occurs, again, across the lifespan. So it's not just younger adults who are experiencing it, as 30% of victims are over 50. Stalkers often choose their victims intentionally based on their perceived or actual vulnerability. So if someone, is living with a disability and, may be not financially secure or have stable housing or something of that nature, they may be targeted. And it is often dangerous. So it's something to be taken very seriously. So it's really important that service providers are doing the proper safety planning with them, checking in with them often, and documenting incidents as they happen or occur. So now I will turn things over to Marty for our next section.
Thank you. We're going to talk about barriers that older survivors may face. Older survivors face many barriers based on just certain dynamics of being in later life. Like, for example, they might have the family value that no matter what, your family stays intact. Let's say, take, for example, a situation where an adult child is the abuser. And if the older survivor makes some kind of report, then they may jeopardize their relationship with their grandchildren, and their grandchildren are their world. So they're going to just live through anything rather than jeopardize that relationship. Older survivors may have more isolation than younger survivors. Maybe their support system or their friends have moved away or passed away. Family members have moved to another area of the country. They tend to have less of a social network as you get older. There's also concerns that no one will believe them. I had this situation when I was working in Nevada. I had a deputy say that the person no one would ever sexually assault somebody in their 90s. That just would never happen. So you have this idea that people are afraid to even report because they're afraid that they won't be believed. They might have health or capacity issues where a report might mean that there'll be a lot of intervention that they're not ready for, or that the person will discount what they experienced because they have this health or capacity issue. Older adults may be less able to overcome a huge upset in their economic situation. They may not be able to just leave because there's no way to support themselves. You also have the situation sometimes where the survivor is financially supporting the abuser, and the abuser has told them over and over again, if you go, what will happen to me? And they love that person. They don't want to just abandon them. Another barrier in seeking services is generational and societal values. Older individuals may be more likely to not want to air their dirty laundry. They want to keep what's going on to themselves, and they don't want to tell other people. Also, keep in mind that possibly if it was a long-term relationship, maybe they reported in years ago. And we know years ago, the field of domestic violence was such that they'd say, hey, you stop goading him, and you take a walk around the block and cool off, like it was an anger management issue. And so we've come a long way in understanding that it is about power and control and not anger management. But a person may be less likely or hesitant to make a report if that's what they experienced before. Also, a tactic that a lot of abusers use with older survivors is this fear that if you report me, I'm going to put you in a nursing home. It's that fear of losing their independence that keeps them in a situation where it's abusive. Also, they might believe that the services are not designed for them. An example of this might be if they go to a support group and they're talking about childcare issues, and that may not feel relevant to them, and so they might feel, oh, this support group really isn't designed for me, or shelter services may not be designed. They may have a room that is compliant for disabled or people with mobility issues, but that doesn't necessarily mean that it's an appropriate placement for an older adult. There may be lots of children around, and so there's trip hazards or noise that an older adult is not used to. So they may really be afraid to reach out for services because they feel that their needs won't be met. Besides reaching out for services, they also may have barriers when they're trying to access the available services, like not being able to get their hands on materials, especially if they're all online and an older adult is not sure where the services are, so they may not look in those places. They may have services in areas of the community where the older adults don't frequent. They may find that even if there is a shelter or even if there is an agency to go to, that if they have mobility issues or have difficulty hearing, that they won't be able to serve them once they get there. There may be language barriers or different community practices that they feel the services won't be accessible to them. They may lack emotional support. They may feel that the individuals, the staff at the services aren't really equipped to work with older adults and can't give them the emotional support that they need. They may need more frequent breaks or have incontinence issues and need products for that. So some medical needs that services might not be able to provide. And then you have transportation challenges. Older adults, I mean, there's people across the lifespan who don't drive, but you have more of a chance of seeing that with older adults. There's also, it's difficult to access services if when you go, law enforcement or prosecutors or court officials or service providers are not specifically trained in working with older adults. And that's why when I talked about before bringing in aging services professionals, if you are working with an older survivor, it's just this lack of training may mean that they don't recognize what's in front of them or they're not sure what to do. So it's really this lack of coordination across systems can really result in some people falling through the cracks. There could be a lack of funding to address services, and an agency may not be able to have the funding to specifically create programs that are intentionally focusing on older adults. So it could be a lack of funding and also a lack of affordable and appropriate housing we hear over and over from our grantees. Finally, I've got to say ageism is a major structural barrier to accessing services. And when I say ageism, I'm talking about how we think, how we feel, how we act towards others based solely on age. It can influence policies. It can influence healthcare. It can influence our daily interactions with older adults. And these perceptions may color how we work with these older adults. We're surrounded by messages every day that aging equals decline and that youth equals beauty and strength. And so this can definitely play into how we work with older adults. When you look at living situations, and I mentioned this before, that we often think of older adults living in nursing homes, but only 4.5% live in nursing homes. And we also think about health when we think of ageism. And 80% of older adults have a chronic condition. So there is a lot of conditions out there, but the vast majority of them are still vital, and they're not limited by those chronic health conditions. The sexuality is not thought of when you think about an older adult, and capacity. I want to get away from this idea that older adults are experiencing dementia. Certainly, it's very real that a lot of older adults experience dementia, but not all. And so it's really important for us to understand capacity issues and who might have expertise in that area, so we can partner with them, so we can make sure that we're not making assumptions about capacity. Think about if you see a confused person who's scared and confused. If that person is younger, you're more likely to think, oh, they've experienced some trauma. Look, they're scared and they're confused. Let's help them. If the person is older, you might think, oh, this person has dementia. Look how confused they are. So you can see how ageism really plays into how we work with older adults. And with that, Victoria.
Hi again, everyone. So I'm going to take some time to talk about supporting survivors of abuse in later life. And we've started to touch on this already. So there's some more things I just want to highlight for the next few moments with you. So it's important that you start with being victim-centered. And what does that mean? Why be victim-centered? This is because perpetrators and abusers often isolate victims, take away their decisions, take away, their sense of autonomy, their sense of self, work to really strip confidence, isolate them from the things and the people who are supportive to them. And so when you utilize a victim-centered approach, which is really putting that survivor, that victim's needs first, building out our service plan or safety plan based on what this person needs, versus trying to tell them what would be best for them, that really restores power and a sense of control and agency to a victim of violence. For victims that have survived abuse, they are truly the best judge of their own safety. They're the experts in their own lives. And so when we utilize a victim-centered approach, we're underscoring this, that survivors and victims of abuse, and for older adults in particular, being victim-centered in our approach, having them lead the way, supporting their every need is so empowering for them. And so we want to encourage that approach in how you support older adults through service provision. And in victim-centered engagement, what are some ways to do this? By investing the time that's needed in working with a victim of older adult victim. What we have found from our work and even from advocates we talk to across the country is that you have to utilize patience. Patience is a key factor in working with older adult victims. It may take more time for them to share and disclose the violence that they've experienced, especially if it's been years of abuse. If we think about someone like Mary Lou, who had been in a long-term marriage, had faced abuse for decades, it can take time to open up and to share that. Someone even mentioned in the chat earlier how that can be a challenge for older adults to maybe disclose and share what they have experienced. Those from previous generations of baby boomers and before, may not feel comfortable about talking about what's happened in their home. There's often this sense of privacy with older adults and not sharing what happens in a family home. So it can take more time to build that trust to get them to share what they have experienced. And in order to do that, it's also important to listen with compassion always. See what they want to have happen and why. Determine that person's communication style. Use their language and their terminology. Kind of mentioned this before, but someone may not say they're being stalked. They likely won't even say they're being abused, but they will maybe tell you what's happened. And so wanting to use that language is important. So someone shares, they're using my money without my permission, or that person touched me where they shouldn't have. may really allow a victim or survivor to connect with, to use that language, to connect with what's happened to them versus saying, oh, you're a victim of financial abuse or you're a victim of sexual assault. Respecting that person's generational values and their views is so important, and recognizing things that can re-traumatize. So when someone using their body language to see how much they want to share, if they feel comfortable, not to press too hard, but to give them the time that they need, and recognize it may take many sessions in order to really allow someone to share all that they've experienced. So it's important to, really take your time in working with older adults. Make sure that you are utilizing patience, and recognize that you may have to have more conversations in order to build the rapport and trust that's needed with this person. So adapting your outreach is also critical. I used to be a safe house advocate and worked at a local safe house in the area where I live. And it's important to recognize and to look at your materials of outreach. If your pamphlets or brochures or website, has pictures of younger adult women or pictures of women with young children, or there's really a central focus, and services really seem to be focused on younger adult victims, that may really impart or share to someone an older victim that this isn't for me. Oftentimes, lots of agencies or safe houses may have specific services just for older adults, or may even have an advocate that works specifically with older adults. So a support group for older adults, or even just mentioning that they have mobility services or transportation help, that they're ADA compliant. Those things can communicate to someone who has those needs and who is of older adult age, who's 50 and over, that, oh, this is a place that can be accommodating to me. So also being careful not to reinforce stereotypes about older adults, right? All older adults don't use canes, and everyone's not in a wheelchair. So showing, people throughout the lifespan and spectrum of abilities is important. Also, your language that you use is very important. Many agencies that we've worked with who serve older adults share that they may, with older adults, they will use a handle and not call them only by their first name. So Miss Mary or Miss Johnson may be, much more appropriate for them. So asking them what would be the best, how should I refer to you? What name would you like me to use? Can really show your respect of older adults. And also just the use of that term. You notice I'm saying older adults, not seniors, not the elderly, which can often have more connotations of someone who is the older adult. It really connotes ageism as well, or even that someone is more frail or feeble just by using the term senior or elderly. That can happen. So we hear that older adults, we utilize the term older adults in calling with our work. Safety planning, such an important piece to touch on. This is a process that helps victims identify their safety concerns and helps them to think through options and plan their next steps. Safety planning is something that can be formal or informal. It can be a plan that you write up, but it may be a conversation. It's something that really any of us can do. You don't have to be a certain professional, but it is, so important to that it's something that when you do talk with an older adult who has been victimized, to start to ask them the questions to really start to identify a plan of safety. And this can be so empowering for older adults and for victims, because they get to plan and they get to have have identified a course of action as to what they can do if, when they face abuse again, or should another situation arise. It's important that, when you do safety plan, that, it's tailored for that person's needs. So if they live with their abuser, if they're planning to leave, or if they're living separately, must be client-led, personalized, and also needs to be ongoing. It's not a one and done. Some of you may use checklists or templates for a safety plan. That's great, but they shouldn't be comprehensive. They should not only be focused on that, right? Because there may be things outside of that checklist, but it can be a great start. And also recognize that safety plans, they can't guarantee safety, but they can help to make someone feel safer. And, they're an important step that can work to achieve that. They can focus on physical and emotional safety as well, and also include pets or children or other dependents or grandchildren. They can focus on, important that they focus on that survivor's priorities. You may see something as a service provider that you think would be best, but it's always important, of course, to follow and to focus on what that survivor has indicated that they need. What are some additional topics to consider in your safety planning? What to do in an incident, who to call, if there's pets involved, are there firearms or weapons, any other dangers that you need to know about in the home. Also explore additional safety features like new locks or changing keys, or maybe, even technology that can be helpful in safety, from alarm systems or things like the ring. Someone needs to leave quickly to help them identify a plan. Maybe they have a to-go bag and put important documents or some money, medication in there, things that they would need. Talking about coping strategies and what supports that they may have. Who can they trust that can be helpful? Of course, you want to consider someone's health and their mobility. If they do use mobility assistance or a device, or they need help with their daily living activities, that needs to be taken into consideration. And also the caregiving context, to kind of piggyback off that last point. If someone requires caregiving needs, that also must be taken into consideration. How can those needs still be met if as long as they're in that situation, or if they do want to or plan to leave. So here we've got a QR code for you to scan that can give you just an overview and a planning template, if you will, for safety planning that you can use. Again, these aren't all comprehensive. There may be some other factors that you want to consider or that are important to you and the survivor that you would be working with. But you can scan that QR code from our NCALL website. All right. And I will turn things back over to Marty for our next section.
Thanks. So these cases tend to be really complicated and complex, and it's very unlikely that one agency can do it all. So it's really important to be thinking about, is there system awareness across agencies? Is there ways that you can collaborate? Is there ways that you can do meaningful work together to support an older survivor? Some ideas might be to focus on system level coordination. And the idea of a coordinated community response looks at system level assessment and change versus a multidisciplinary team or an MDT, where you would do individual case consultation and talk about particular individuals. CCR, coordinated community response, is about looking at the interagency involvement with each other. How much do they know about each other? How much do they work back and forth between each other? And what's working well and what needs to be improved? Because collaboration is really the key there. And it's really important when you do have a group of individuals working together that you make sure that you have membership that reflects your whole community and everyone's lived experience. So you have all those different perspectives together. Some people that might be involved range from faith leaders all the way to the criminal justice system or community programs or an ombudsman. On this slide, you see various agencies to consider, but this is by no means a complete list. You want to make sure that if you are collaborating with individuals in your area, that you've got all those aging services professionals and anybody who might encounter older adults in the course of their work. What might it look like? This collaboration could look like sharing resources, like doing joint interviews with each other, so the person only has to go through the process once, if that's allowed. Exchanging information with each other about what your process is, what your limitations are, so the different agencies can understand each other and understand what each agency does to support older adults. Exploring ways that you can enhance each other's work, like If it's safe to do so, can an aging services professional go with law enforcement when responding to a call? Can certain questions be added to each other's intake forms so you can help to gather information that would help to support that older adult? There's a lot of benefits to collaborating. Not only does it open you up to more resources and new ideas, having all these different perspectives coming together, but now you have this seamless response where you might not be making a poor referral because you didn't know what that agency did. Now you understand what could make it a more seamless experience for the survivor. Shared ownership and responsibility. Sometimes you might assume, oh, somebody else will take care of it, where it's really important to never assume that somebody else is going to address the abuse. There's this shared ownership and responsibility that we all are responsible to address the abuse. And it certainly enhances victim safety when everybody's working together. Key takeaways: victim-centered approaches engage and empower that older victim. Nothing about us without us again. Safety planning helps victims regain a sense of control by planning ahead of a crisis. No one entity alone can address the complexity of abuse in later life. Coordination and collaboration are key because everyone deserves to age with safety and dignity. And with that, I'm going to turn it over to Neelam Patel.
Thank you, Marty. Could I tell you to move the slides for me? Perfect, thank you. So the next few slides, I'm just going to really quickly talk about the Abuse in Later Life Grant Program. It is one of the oldest grant programs at the Office on Violence Against Women. And as Marty had explained earlier, it is really about a comprehensive approach. The CCR is absolutely important with the Abuse in Later Life program, and it covers all victims who are 50 years and older. So you can also go to our website to look at, we have a current notice of funding opportunities posted. The applications are due July 10th, so it may not be enough time for all of you. Some of you that might be interested, some of you might have already started your applications. But I would encourage you all to go and look at the NOFO to learn more about the program. Also on the OVW website, there are information sheets about all of our different grant programs at OVW, including the Abuse in Later Life program, so you can learn more about it. Also on our website is a list of current recipients as well, so you can see the different communities for which we are funding this grant program. So collaboration is key for this grant program. Next slide, Marty. Thank you. So it is about systems change, and as was explained throughout the presentation today, is that it takes everyone to address abuse in later life, from the law enforcement to victim services, legal services, prosecution, judges, medical professionals. Cannot do this work alone. We all know this from our work in domestic violence and sexual assault. That CCR is so important. And it is a key component of this grant program, as we'll talk about in terms of the required partnerships. Next slide. So first, we'll talk about the purpose areas. Statutorily, there are 4 purpose areas for this grant program. As we've been discussing already, coordinated human response is at the fundamental of it. You are required to partner with law enforcement, victim services, individuals with expertise on abuse in later life. Also required are victim services as well, as you all do as that. But a key component of this within the statute are the training. And after I'm done presenting, Marty and Victoria are going to talk a little more about the resources they provide, because Abuse and NCALL provides training, comprehensive training to the Abuse and Later Life program, which includes train-the-trainers for law enforcement, cross trainings on how to train all your members of your CCR, and also individual trainings for victim services and prosecution. So these are key components, again, statutorily. Next slide. Oops. Oh, sorry, next slide, thank you. Oh, the one slide before. There we go, thank you. So again, as I mentioned, it's statutorily required MOU partners. We get this question sometimes from applicants. Do they need to partner with a law enforcement agency? Yes, they do. Again, it's statutory. As was written, this is really about a collaborative approach with this grant program. Required also a prosecutor's office, a nonprofit organization or government agency that has demonstrated experience in assisting individuals 50 years and older. So that is key that we look at within the MOU partners. And again, also a domestic violence sexual assault service provider. So absolutely necessary for that. And you can always talk to NCALL about how does, what are the roles of law enforcement within the MOU partners. Any questions about the grant program, please contact the email address below on the slide, ovw.elder@usdoj.gov. Next slide. And I will move this over to Marty and Victoria. Thank you, to talk a little more about their TA projects.
Thank you so much, Neelam. Just want to make sure that, okay, all right. Thank you so much, Neelam. So I just want to tell you all a little bit more about NCALL as a technical assistance provider. And so we provide support and even training and assistance to grantees from across the country who have been awarded the Abuse in Later Life grant. So from all of the components that Neelam just mentioned, victim services and training is a huge part of the grant, as she mentioned, the cross training and the coordinated community response. And training also involves the justice system professionals as well. And so we provide lots of support, monthly calls as well for grantees, lots of email services. But in all of the planning that takes place, we provide feedback, information, guidance to grantees on successfully completing the deliverables that they have to for their grant. So just so know that if you are interested in applying, that NCALL is a great support. We really pride ourselves on being close to our grantees, really working to support them and to meet the needs that they have, so ultimately they can help them to be successful in their projects. But I'm also excited to tell you a bit more about our resources as we start to close things out. The National Clearinghouse on Abuse in Later Life, NCALL, we have a robust website of resources with lots of information for you as service providers, for professionals, for victims and survivors themselves. So some of the things I want to bring your attention to is our publications library. So we have many toolkits on, which I'll get into some in just a moment, on a whole range of just topics from those who are in the many different sectors that we address. So service providers to community leaders, also those in the justice system, law enforcement, victim advocates as well. And we have a video library. So some of the videos you saw today, but we have a large video library that also is housed on YouTube. So you can share these videos in your communities, for events that you may have, and things like World Elder Abuse Awareness Day to bring more awareness to this issue. And speaking of that, we have materials on World Elder Abuse Awareness Day, many of the months that commemorate abuse from Domestic Violence Awareness Month, Sexual Assault Awareness Month, Stalking Awareness Month, that you can utilize to spread awareness and increase the word about these types of abuses and issues that older adults are facing. So you can go ahead and scan the QR code, but you can always go to our website, ncall.us, for more information. Additionally, we have abuse in later life information sheets because we may often think that abuse in later life is pretty specific. It's inclusive, obviously, of elder abuse, but elder abuse is actually much more than abuse in later life, and so abuse So we have some specific sheets that can give you more information to learn more about abuse in later life, and of course to share with others to learn. You'll find them also in our publication library. We know how important it is to work with faith communities at NCALL, and so we do have a toolkit on partnering with faith communities. For older adults, their faith and their spirituality is often a very important part of their life and their lifestyle, and source of support for them. And so we also partner with an organization called Safe Havens to inform us, and we work with in having materials for the community, for the field, for service providers to work to partner with faith communities. Also advocacy in tribal communities. For some of you, you may live in a location where you may be a part of a tribal community. So our grants also, we do have grantees who are from tribal communities. And so we do have a toolkit specifically on addressing harm to Indigenous elders and developing our response within a tribal community that has been informed by leaders of various tribal communities across the country. Also for rural communities, we definitely recognize that those who live in more rural locations, may face additional barriers or challenges. Services may not be as abundant as in more urban areas, and also just different strategies may work much better in rural communities. So there's a toolkit to address that and to help you with that, even about partnering. If you live in a more rural area but want to do more partnership and work with, if you live in a more urban community and you want to partner and work with those in a rural area, this toolkit can be helpful, and vice versa. The system change workbooks. These are a great resource as well, especially for those of you who have a coordinated community response team, also known as a CCR team or CCRT. If you're interested in starting one, and these workbooks can help you to learn more about some of the things you can work on. These teams are designed to really change systems and to increase system responses for older adults. So it's not like an MDT or a fatality review that kind of focuses on individual cases. This is really about addressing systemic challenges and how you can change them. And so these workbooks can be really helpful in giving you some more insights as to how to do that from these various sectors, who to bring to the table so that you can have a successful coordinated community response team and really bring about some lasting, sustainable change to your communities. Some additional awareness and outreach materials. Some of these I touched on, but definitely want to encourage you to check out our graphics library. There are graphics that you can utilize in your own social media posts or maybe emails, email newsletters, things of that nature. So we want to make it easy for you with some graphics that we've used over the past few years, but that are still really relevant today. So thank you so much. You see my contact information as well as Marty's. And so if you have any further questions, please send us an email. We would be glad to, get right back to you with the information or answer your questions that you have. Additionally, I saw many of you ask about the slides being available, and I did see Brianne mention that they will be available or sent out, so not to worry about that. We'll make sure that you all get them. But again, if you have questions, please let us know. Thank you all so much for your engagement, for participating in the chat, we just thank you. So if Marty or Neil, if you have any other closing, but thank you to each of you for attending. And we look forward to your questions if you have any at a later time.
Thank you to Victoria and Marty so much for this wonderful presentation. And my last comment is please go to NCALL for any of your training and TA needs. They are fabulous with really understanding abuse in later life, not just as the comprehensive for the program, but as the OVW Resource Center on Abuse in Later Life. So thank you both. And thank you NCGSCJ for the logistics.
Yes, huge thanks to Mackenzie and Brianne.
Thank you. And I would just like to say thank you to all the participants here today. It's really important for everyone to be aware of the challenges that older adults have, and that they may be invisible when it comes to providing your services. So you coming today to learn more about the topic so you can recognize older survivors when they access your services means a lot for the older adults in this country. So thank you so much for coming.
All right. Great job, everybody. See you soon.